Fox News now on the healthcare countdown. That massive overhaul bill is on track for final passage in the Senate by Christmas Eve. Democrats, uniting against a unanimous Republican opposition, voted in the middle of the night to close debate on legislation that will impact every single one of us. But Republican senators are attacking this bill, saying it is built on backroom deals. Joining us now, Senate Minority Leader Mitch McConnell of Kentucky. I'm guessing you're not a very happy man this morning, Senator.
Well, I'm certainly not. It's bad news for the American people that this bill, which would cut Medicare by $500 billion, raise $500 billion in taxes, and create higher insurance premiums for everybody else, seems like it may be on the way to clearing the Senate. But let me assure everyone, that's not the final word. There are other significant problems with this legislation that the House may not accept. This debate is far from over.
Well, our ace White House reporter, Major Garrett, said that the White House is confident that now that the Senate has passed it, whatever differences remain between the House version and the Senate version are going to be combined in a way that can reach the president's desk.
Well, the White House was confident it was going to pass before the August recess, too. You know, the House of Representatives will have to basically back down on virtually everything they passed for this to become law. It'll be interesting to see whether there's any institutional pride over there, and whether they're willing to fight for their version, which is actually even worse, if that's possible, than the Senate version.
Let's listen to some of what the president had to say a moment ago in talking about how much this might save the country. I'd like to get your reaction on the other side.
This cuts our deficit by $132 billion the first 10 years and by over $1 trillion in the second.
A simple question, Senator. Do you agree?
Of course not. I mean, if it ends up being deficit neutral, which it will not be, the only way it could be that, achieve that neutrality would be with these massive Medicare cuts, which is why senior citizens are overwhelmingly opposed to this bill, and the massive tax increase. It's a tremendous expansion of the federal government into all of our lives in the most personal way, our own health care. I doubt if there's any chance in the world this will end up being deficit neutral, that is, not expanding the deficit. But if they manage to do that, it'll only be on the backs of seniors and out of the tax pockets of virtually everybody in America.
Well, Republicans obviously stood in unanimity to oppose this thing, but it is going forward anyway. What more do you think that your party and your caucus in the Senate can do?
Well, the American people certainly know where we stand. Not a single Republican voted for this. Every single Democrat was needed to pass it, and that means that every Democrat in the Senate is responsible for its passage, because if even one of them had the courage to stand up and say no, it would not have passed the Senate.
Well, it passed the Senate in part because senators like Ben Nelson got some pretty good deals for their states, right?
Yeah, he cut a sweetheart deal for Nebraska that no other state in America gets. And interestingly enough, the governor of Nebraska and the other senator from Nebraska rejected it. They didn't think a decision like this on all of the nation's health care should be determined by some special fix for one state.
Senator Reid, the majority leader, when asked about some of the compromises that are throwing money at individual states like Nebraska and Louisiana, said a number of states are treated differently than other states. That's what legislation is about, compromise. Your response?
Yeah, look, I don't think a legislation like this, which affects every one of the 300 million Americans in their own health care, should be subject to this kind of special, smelly deal-making in some conference room somewhere. That is not the way legislation of this magnitude should be passed. You know, it's important to remember that major social legislation in our country, like the passage of Social Security, the passage of Medicare, the passage of the Americans with Disabilities Act, was done on a broad bipartisan basis. Here they've jammed through an effort to restructure the American health care system, to have the government take over 1/6 of our economy on a totally partisan basis. That might explain why the people are overwhelmingly opposed to it. They are very much opposed to it, and I think looking to the November 2010 elections, the majority will pay a heavy price for ignoring the wishes of the American people.
Well, this bill is projected to put 31 million more people under insurance, but the expectation is, at least some economists are saying, that the only way to pay for that is to increase the costs that private insurance charges people who are already carrying insurance. Do you agree?
Yeah, I mean, we know that insurance premiums are going to go up for everybody who currently has insurance. That's about 85% of America. We know under this bill, the taxes kick in a few weeks, whenever the president signs it. Whatever benefits there are, such as expanded coverage that you mentioned, are delayed for many years. This bill is a mess. Cobbled together, a special deal riddled package that just underscores what people tend to think of Congress anyway, and this certainly underscores that impression.
So that's an interesting point, and I, have mentioned it before, but I didn't realize we were talking about it starting this quickly. You're saying that taxes to pay for health care reform will kick in as soon as the president signs the bill?
Yeah, and it's also got another provision there related to long-term care, which was described by the Democratic chairman of the Budget Committee in the Senate as a Ponzi scheme. It basically starts raising taxes very early, and the benefits will get paid out way on down the road. I mean, this bill is a complete mess and should have been rejected last night.
Final question, do you think it'll become law?
Well, I think it's still got significant problems. For example, the Senate bill allows tax dollars to pay for elective abortions, and the House bill does not. This is a very, very important issue. For 30 years in this country, we've had consensus that no matter how you felt about abortion, federal tax dollars should not be paying for it. Those are very significant differences between the Senate and House bill. The Democrats are going to have to figure out how to wrestle with that one.
Mitch McConnell, the minority leader in the U.S. Senate. Senator, thank you.
Thank you.